Welcome back to RainierAvenueRadio.world. It's me, Tony B. This is our special broadcast of the impact of the coronavirus on South Seattle and surrounding communities. We'll continue this conversation, and joining me is Evan Bush, a reporter for the Seattle Times. Evan, how are you?
Doing great. Thanks so much for having me. Very excited to talk with you.
Evan covers COVID-19 pandemic, but Evan's also worked at Seattle Times for 8 years, and in the past has covered climate change, the environment, and breaking news. Evan, why don't you share a little bit more about your background with us?
Sure. So, like you've mentioned, I've been at the Seattle Times quite a while, and started out working on the website at the Seattle Times, and then transitioned to become a reporter about 5 years ago. And it's been a very interesting job. So I've really enjoyed it. And I grew up in Minnesota and Texas, and love Seattle, Washington. So I've been out here about 8 years now, and really excited to live here.
Now, Evan, I'm going to give you some room to share information with us. You've been covering this pandemic, and I want to know more about that. But specifically, we are hearing more. It's coming up in the news. It's been part of the election cycle. The vaccines
Mhm.
and the different entities working on vaccines. We've been hearing, maybe a vaccine might become available before the election date. We've been hearing mid 2021. Now there's also concern from folks about uh, whether they will take this vaccine. And of course, once it becomes available, who gets it first? How's it going to be distributed? I'm going to give you the room here, I just to give us from what you know. And again, a great article that you wrote about this. But let's start off with vaccines. Can you just give us the 411? And I'm going to give you all the room you need here. So take your time as a reporter to talk about what you've uncovered, discovered, or just reported on regarding the availability of vaccines, specifically in the state of Washington.
Sure, yeah. So there's a big national effort right now that involves the federal government, state governments, local governments, and then pharmaceutical companies and research scientists to bring a vaccine to the nation and the world. And that's been going on really since the beginning of the pandemic. Vaccine development takes a long time. It's very complicated. Lots of clinical research goes into developing a vaccine and making sure it's safe and effective. And because of the urgency of COVID-19, the impact it's having on communities across the nation and across the world, that timeline is faster than it would be normally. And so what the government is trying to do is take out some of the bureaucratic steps to bring a vaccine to market, if you will, and trying to compress that timeline. So there's a bunch of different companies and research entities that are working on vaccines. More than 100 vaccines are being developed right now. There's some that the federal
I'm going to let
government.
you keep going. You
Oh,
said
yeah,
more than 100.
yeah. So there's all kinds of research going on, and the national academies of science and medicine have counted more than 100. There's one vaccine being developed, by a researcher at the University of Washington right now, Deborah Fuller, and there's many that are being pushed forward by some of the big pharmaceutical companies. Not all of them will make it, right? There's only a trial process, which is typically talked about in phases. So there are several, though, that are in phase 3 clinical trials. And so phase 3 clinical trials, that's when the vaccine is being essentially tested on tens of thousands of people.
Evan, would
And
you mind
yeah,
going back and telling us, starting, what is phase one and then phase two, and then go back to phase three, just to get everybody up to speed on what that means when you say phase three?
sure, sure. So phase 1 is when, first, actually, before phase 1, there's preclinical testing. So scientists will test, a vaccine on cells, or and give it to animals like mice or monkeys, and see if it produces an immune response. And then there's phase 1 safety trials. So the vaccine is given to a very small number of people. And that's for testing of safety and dosage. So figuring out, well, how much vaccine is the right amount to produce the right to produce the right immune response. And then phase 2, that's when it might be hundreds of people, and it's split up into groups. And then phase 3 is what's called an efficacy trial. So phase 3 is when you're giving the vaccine to thousands or tens of thousands of people, and you're also using a placebo as part of the process. So some people get the vaccine, and some people get something. They get a placebo, and they don't get the vaccine. And so what scientists then are looking for in these phase 3 clinical trials are, does the vaccine work, and does it protect against the novel coronavirus? And so that's what the advanced trials look like. And so there's several vaccines that have reached that point, and are being tested in tens of thousands of people right now. And the next step is approval, or authorization for emergency use. So regulators like the Food and Drug Administration want to look at the vaccine. They want to see the data. They want to see the data from these phase 3 clinical trials in tens of thousands of people, and see that the vaccine works, and also see that there aren't any red flags on safety, and make sure that that it's doing what it's supposed to be doing, and not causing any harm.
And when we get to the what is the point where it's like, okay, let's roll this thing out to the public? What do you call that, and that process?
Yeah, so it's a little different for the coronavirus, because of the urgency I mentioned earlier, and the urgency we all know because we've seen it in our communities, or where people are getting sick, and people are dying, and the virus is spreading. So the Food and Drug Administration has said that it will consider emergency use authorization for vaccines for COVID-19. And what that means is the company will gather up its data from all of its trials, and particularly the phase 3 clinical trials, and allow the FDA to review that data. And the FDA has said that'll be a public process, and that the data will be available publicly for review, and that they're going to make that a transparent process. And then the FDA will decide if they will approve that for emergency use. And so the companies that are making these vaccines, they're in a position where they will essentially choose at what point they think that it's time to take a look at the data and see if it works, and then they'll send that off, and that's the point at which outside researchers and regulators get their first look at the work that they've done, and if they want to say this is safe and effective enough to be given to the public. And it's vaccines are different, right? Because you're talking about putting something into healthy people's bodies. And so there's a high standard that needs to be met for safety, and also to make sure that it's effective enough to really impact the pandemic. So the Food and Drug Administration has said that it wants a vaccine that protects at least 50% of people who receive it. And so a vaccine that protects that many folks, that percentage of folks, could make a real big impact on the course of spread of COVID-19. And then there's questions about, well, how widely within the community, will the vaccine reach, and how quick can the government get it to people? And so there's huge challenges of developing a safe and effective vaccine. There's also huge challenges in distributing the vaccine, doing that efficiently, and storing the vaccine. And it's a huge operation. And so that's kind of what we've taken a look at. And the state recently outlined some of its early initial plans for distributing the vaccine if a safe and effective vaccine does become available soon.
Again, my guest is Evan Bush, Seattle Times staff reporter. You got to check out a few of his articles. Been covering the pandemic. From what you know, Evan, or from what you feel, or what you see, you mentioned 100 potential vaccines. Which one are we gonna get? I mean, or will there potentially be multiple vaccines that become available?
Um, all the experts I've talked to have said they think that multiple vaccines will eventually become available. Now, when we're talking about hundreds, those are vaccines in all kinds of different phases, right? So, I don't view it likely that we'll have dozens of vaccines. That would be, sort of not useful at some point to have more than a handful. I would expect multiple vaccines, and the reason is the manufacturing part of this is going to be complex, and the distribution is going to be complex. And so, to get people vaccinated quickly and effectively, it makes sense that you would have doses of many different, if multiple vaccines are proven safe and effective, to have doses of multiple vaccines to be available to people. And keep in mind that we're talking not only about the United States, but the world. We will, as a nation, will likely, be producing vaccine out of U.S. research, and sharing some of those vaccines with the rest of the world. And so that's kind of what we're talking about. And so having multiple vaccines in the pipeline, gives you more chances to get it right. Because if the phase 3 clinical data on one of these vaccines says, it's not going to work, or like we're a little concerned about safety here, then the next one in line maybe makes it, and then you're talking about widespread distribution, and that's the challenge at that point, and that's why you're going to need multiple vaccines at that point.
My guest again is Evan Bush, Seattle Times staff reporter. This is Tony B, and our special coverage of the impact of the coronavirus on South Seattle and surrounding communities. Evan, we know that everybody wants to return to some sense of normalcy, even though we try to come up with new normals, and a vaccine would be something that might set us on that path. You mentioned, this is going to have to be distributed all around the world. Well, let's take a look at Washington. From what you know, where does Washington State fall on that pecking order? What are the processes that are needed to say, hey, you're going to get it. This is the This is how you're going to get it, as opposed to New York or Alabama or Minnesota. Is it something that depends on the governor? We've recently heard things that there may be a preference given to some states, whether they're considered to be red or blue states. What information can you share with us about the distribution and where Washington State may fall in accessing this vaccine?
Sure. So first off, I know that there has been talk about having, an approved vaccine before Election Day. I don't view that as realistic. I don't see that happening. And so I think what we're so the state of Washington was required, the health department was required to submit a vaccine distribution plan to the Centers for Disease Control and Prevention, the CDC. And they did that last Friday, and the public got its first look of that plan this week, actually, on Wednesday. And it sort of outlines what the state's expectations are and the phases in which vaccine would be distributed to Washingtonians. And the state, in that document that they published, they think that in the first 2 months of distribution, this is their estimate, that Washington will receive about 2% of the initial supply of vaccine. And their estimate is that would be enough to vaccinate between 150,000 and 450,000 people. And I want to remind everybody, we don't have approved vaccines. It's not clear which vaccine, there's several that are late in stages. We don't know which one is going to get there, or if one will get there at all in the next several months. But that's the state's just initial thinking about that. And so then the question is, well, who will get the vaccine, right? And so the state, they've sort of created this 3-phase plan, and this is a very early initial plan because everything's going to change when we know more about which vaccine gets approved or which vaccines get approved. And the plan basically sets up these phases. And in the first phase, when vaccine doses are likely to be limited, just because they haven't had enough manufacturing time, there's just not enough supply out there. So in those first 2 months, the folks who would get first access, according to this initial plan, which could change, is high-risk workers in healthcare settings, first responders. So that's fire department, EMS, ambulance folks, and police, other essential workers, and people with comorbidities that create a high risk for COVID-19, and also adults in long-term care settings. So that's situations in which adults are living close together in long-term care. And so those are a lot of the folks who, for various reasons, are believed to be at high risk or are extremely high value when you think of things from a pandemic perspective. So healthcare workers, for example, those are folks that we need to take care of folks who do get sick with COVID-19. First responders, same idea. People with comorbidities, those are the folks who are most likely to die or get extremely sick with COVID-19. So folks who have maybe diabetes or heart conditions that would put them at greater risk. And so that's the first priority group. In the second phase, when things become more widely available, and maybe there's multiple vaccines at that point, then the state plans to make the vaccine accessible in a lot of different settings. So pharmacies, community health centers, primary care offices, occupational health clinics, and other places. And then in that third phase, what the state hopes to do, and the Department of Health hopes to do, Department of Health hopes to do, is work in areas where there's gaps. So where the vaccine did not get to right away, and also places where people maybe aren't interested in taking it, and they really want to boost the confidence of folks, about vaccination, because there are folks with concerns about taking vaccines, and and in that third phase, the state would seek to reach those folks and get their consent to be vaccinated.
My guest, again, Seattle Times staff writer Evan Bush, sharing this valuable information. We've been hearing about vaccines and timelines and when it might become available, who might get it. We have a group of folks who we've been calling essential workers, folks who work at grocery stores, who are public transportation, and we've been saying, hey, these are heroes. They're out there doing. Where do they fall on the spectrum? These folks who we've been lauding as essential workers, and places where you have to go. Do you know, Evan, where they fall, or has there been any consideration to this group of folks who, again, we've been calling essential workers during this time?
Yeah, so that's a great question. And this first phase, there's a lot of work for the state left to do on figuring out who will get, the first doses of vaccine when it's very limited. And essential workers are among those. They're in that first phase, that first group. And so, but how the state decides, who qualifies, a lot of those questions are not known yet. And so the state is going to have to do a lot more work on figuring out the priority and figuring out, within that first phase, who qualifies and what kind of essential worker they're talking about. And I don't think that we have a clear understanding of what that looks like just yet. And again, we don't have an approved vaccine, and so they're going to be doing a lot more work on this draft plan, this interim plan, and that's going to be part of that work, from what I understand.
Evan, it seems like we just started talking, and you have been giving us incredible information. I have a bunch of more questions, but just due to the time constraint, um, how has it been for you switching, working, as a reporter on this pandemic? How has that? What's that experience been like? What are you, what are you feeling about all of this?
Sure. I mean, it's been complicated, I think, for everybody. Everyone's lives have changed, and mine included. And I I think for me, it's been really valuable to have this experience and feel like I'm doing something that matters to people and providing information that people dearly need and value. And so that's been really rewarding. It's also been challenging to know and to figure things out as we go. I don't have a background in reporting on pandemics, and so I've been learning
Thank
a lot.
goodness.
Right, I don't have all the answers, but my job is to go and find them, and sometimes I get to answer the questions that I have in my own life, and what kind of for example, what kind of risk I'm comfortable with COVID and my family, or I'm curious about vaccines too, right? Everybody wants to know more about that because that could change the course of the pandemic. So I really value being able to understand and learn about this. And but it's also sad reporting. It's hard to talk to folks who've had losses in their lives because of this, and it's hard to talk with at times healthcare workers who are putting a lot on the line for society, and other essential workers who are doing all kinds of important work and taking greater risks than they ought to have to take at times. So that can be heavy, and I think everybody owes a lot of folks gratitude, and and I hope we can all pull together and get through this thing, and I think we will.
I want to give you the opportunity for final words here, Evan, before we go. If there's anything that you just want to say to folks.
I, I would just love for people to reach out to me. My email is ebush, ebush at seattletimes.com, and tell me what you're wondering about vaccines, what you want to know, because I would like to get answers to those questions if answers are available, and hear from folks, everyday folks who just are curious and I think the other thing that I would say is let's see how this process goes. Let's keep an open mind about vaccines. For COVID-19. Let's watch how the government approaches this and how the FDA um, is approaching this. Let's look at the data, and then let's go from there. And so that's I think that's my final words. Thank you so much for having me. I really appreciate being here with you.
Well, you know what, Evan? I think what we're going to do is we're going to put a call out to find out what questions people have about this. And thank you for that offer. And then we like to get those to you just so that, again, you can help us better understand what it is. Because during isolation, folks don't always know, you know, what other people are feeling or what other people are thinking. And then maybe we can get you back on the air again to join us and share more information with us.
I would love that. Thank you so much, and thank you for what you're doing. It's important.
All right. We're talking about the impact of the coronavirus on South Seattle and surrounding communities. Joining us earlier in the show from Homage, the foster grandparent program. We talked about how they have been impacted, and seniors who work in the community and work with students have had to switch over to a virtual learning program. We also spoke with Hugo Garcia from King County, where there's a King County Local Services about their grant that will be available until October 30th for chambers and small businesses in the area. And again, just finishing this conversation with Evan Bush. We'll be back with more on the coronavirus right after this.